Okay, so now we'll continue with the contrast enhanced ultrasound assessment of focal liver lesions in children. Contrast in ultrasound is a very unusual topic, so we need to pay close attention to it. Huh? Here not, but we can ask for it if we want. It's not that big deal.
Ultrasonography is often the first line image for the examination of children if anyone suspected of having liver lesions. However, the gray scale ultrasound in the color Doppler has some limitations. After the Federal Drug Administration recent approval for the use of a specific ultrasound contrast agent for the evaluation of the focal lesion in pediatric patients, now we can this technique can be used as a problem-solving tool that complement the conventional image that we usually use it and aid also in the follow-up of the lesions. So the contrast enhanced ultrasound has advantage owing to first of all of its safety profile, low cost compared to the cost of the conventional contrast enhanced CT and MRI, and its reliability and reproducibility. Furthermore, the ultrasound examination obviate, meaning prevent the use of sedation, ionizing radiation, and iodinated or gadolinium-based contrast agents and other side effects. So the temporal resolution with this technique enable the ultrasound to depict the real-time internal vascularity of the lesion. It means there will be real-time image and you saw the vascularity of the lesions. The characterization of the lesion during different phases, we will take the same as CT, the arterial and portal and venous. In case in which the focal liver lesion cannot be radially calcified, for example, if it's benign or malignant, which is termed as or classified as intermediate, the contrast intermediate, indeterminate. Sorry. So this technique will be a solving tool for enhancement according to the enhancement pattern of the lesion, whether it's benign or malignant. So this article is based on research done on 2014 and 16, and through this the author had reviewed the composition, the physiological property, and the safety of these agents. And we will, later on in the next slide, we will show the techniques and highlight the utility of this examination in assessment, as we said, for these focal lesions. However, this technique cannot replace the CT for the examination in patients who are hemodynamically unstable and who patients have sustained multiple trauma. This is, for example, of one of the contrast agents. Actually, it was, when it's produced to the market, it was two generations. The first generation, it is the sulfur hydroxide liver type. This one, the first generation. The second two generation that used now in the market, the proflutrine protein type 1. And this is one of the pictures. So investigators, they did in a pediatric study involving 44 patients, reported intravenous contrast-enhanced ultrasound. They showed to have a specificity of about 89% for classifications of these indeterminate lesions. And also in this group, it showed agreement between the after interpretation of the image with the histological. They show agreement of 85%, which is quite significant. So first of all, what do we mean by contrast agent? Now we'll talk about the second generation, which is the most updated. It is a suspension of a gas-filled micro bubbles that encapsulated within outer shell. The gas core, it's quite large and comprise most of the volume of this capsule. And although the type of the contained gas varies from agent to other, however, all of them share that they have inert gas and with low solubility in a high liquid. The outer shell is composed of a stable, high elastic, biocompatible solid coat that also of variable composition. The mechanism of actions. The overall diameter of the micro bubbles mean the contrast agent, because as we said, it's composed of micro bubble of gas. The size of it, or the diameter, is range of 1 to 10 micrometer, which is equal to the size or smaller than the erythrocyte. So because of this size, the microbubbles circulate freely in the bloodstream, and they confined with the vascular system and diffusing into the extracellular space, and even it's capable of reaching the transpulmonary passage. Now, these agents will enhance the intravascular component containing the blood pool contrast agent exclusively, and we will better see the lesion and enable us also to characterize the perfusion of the solid organs at that time. Now, the good thing is that the mean duration for action of these agents is in order of minutes. So, but however, it varies according to ultrasound agent And also it can be affected if the patient have hepatic comorbidity or pulmonary morbidity, as we said, because the bubbles will be reach the lung and will be exhaled. I will show later. Also, it will be affected by the technical parameters by the device itself. Now, the usual route of the phospholipid or albumin shell component is by the liver. As we said, it will be surrounded by a shell. This will be metabolized by the liver. And by this way, there will be no metabolic burden on the kidneys. And this is a quite advantage for using in patients who have renal impairment. Now, once the microbubble will be finish their action and will be destroyed, so the gas is slowly diffused into the bloodstream and eliminated through the lungs by exhalations. So how does it work? So first of all contrast, as we said, agents have the same mechanism in interaction with the ultrasound wave. Once the ultrasound wave start to incident on the microbubble gas after it's giving the contrast to the patient, it will interact with the microbubble. It will cause some oscillating actions like resonating and will produce a positive and negative pressure. This negative and positive pressure will produce a strong transharmonic signal, and it will be reflected back to the device, and it will be show some signal. A specific index, the device will measure it. It will be the ratio between the peak negative pressure and the incidence of the frequency. It will measure it by the device. The important in this index is how much this index will be low, it will be better resolution. So the better MI index will be 0.6. The expansion force is so strong that it results microbubbles and disruption or gravitations, which produce a strong and transient harmonic signal. You know what? After it oscillates and it will produce this signal, it will start to disrupt. That's why now the modern ultrasound units, they do that is they improve a specific parameter in the device that improve this microbubble detection, and with low MI technology enable us to have continuous visualization of these microbubbles before it start to destruct or disrupt. The image that we take it is composed of three main display options. First of all, the grayscale display, the usual that we use it. The second one is the grayscale display with the microbubble, with the contrast, and it will be visualized as a color overlay. And the third one is contrast-only display, in which it will suppress the signal from the background, and in order to enhance or appear the vascularity or the contrast is much brighter spot. Exactly the similar as in this picture. Initially, we will take, of course, the ultrasound if we saw any focal lesion. Then we will take images of a grayscale portion of. It will be a dual image of a grayscale and contrast only. So this will be the grayscale, and this one will be a contrast only display. As you can see, it has suppressed the signal of all the background. Does this technique need any preparation for the patient regarding the contrast? The answer is no. No blood or any urine tests are required to assess the renal function before the intravenous contrast enhanced. It will be injected, and after that, the saline flush will be given immediately thereafter, and then a specific timer on the ultrasound unit will be started, and when the contrast is administered. A specific type of cannula called stopcock port that should be parallel to the about 180 degrees. It means parallel to the venous tube in order not to distract the bubbles, because if it was 90 perpendicular to the venous, it will cause some disruption of these microbubbles. So the technique is very important.
You know, the cannula has two ports, one horizontal, one vertical.
Yes.
So you inject through the horizontal one,
yes,
like the usual, not through the vertical.
Yes. The dose will be, in general, 0.3 millimeter per kg. Will be differ according to the agent. Milliliter. Microliter, 1 kg, and with the maximum is 2.4. However, if the child was more than 24 kg, have we increased the dose. The same of this generation, also 0.3, and as we said, if it is like more than 20 or 24, we have to increase the dose. Sometimes we need to increase the dose if when we are using a high frequency transducers, where the lesion is too deep, or if the patient was obese, we have to increase the dose. Also, sometimes when structure with the small vessels are relatively little blood flow inside the solid lesions, on compared to the other liver, sometimes we need to increase the dose. So, for evaluation of the focal liver lesions, as we said, we will use low MI. We will take, first of all, 1 to 2 minute a cinematic clip, like a real-time clip, and then we'll take clips every 5 minutes. These clips will be according to the phases of the lesions. We'll take static images. The performance of this can deteriorate owing to the low bubble concentration tissue. And sometimes it have some limitations or things that can happen, like low bubble concentrations, motion, slow perfusion, inappropriate setting. Of course, as we said, all phases will be taken into according early arterial, venous, and portal. Now, the principle that we use it in CT and MRI will be applied in here as well, in meaning that the reference standard finding of malignant lesions will show early intense arterial enhancement, hypervascularity, which is sometimes manifested with visible abnormal vessels and early contrast washout. It will be the same here. I will talk about 6 lesions according to the criteria, nearly the same criteria of the MRI and CT. They will start with case number 1. The first case is 39-day-old boy in intensive care unit. It was examined for the child has projectile vomiting, and he had did ultrasound for the pyloric region. Incidentally, they found the focal lesions. This lesion, it was hypoechoic, and it showed partially calcified, and after opening the Doppler, it showed a peripheral enhancement. After giving contrast agent to this baby, it started to show this is in early arterial, and this is in the portal and late venous. It shows a centripetal pattern of enhancement with the late sequences or late phases. It's full peripheral enhancement. And while doing MRI, it was clearly showing the enhancement pattern, the same for the MRI dynamic contrast, and all of these finding is consistent with a rapidly involuting congenital hemangioma. A second case was a 4-year-old boy. He had a focal lesion also detected. This was a hypoechoic focal lesion in the right liver. Also, we are taking So we discover a slide of hypoechoic focal lesions, and after giving the enhancement, it show a spoke wheel pattern of enhancement with a delay enhancement of the scar, and it was consistent with also with the focal nodular hyperplasia, and this have saved the child from unnecessary further investigation or CT or biopsy. Our third case was a 14-year-old girl. She had abdominal pain for 2 months, and also they discovered incidentally a focal lesions. And these lesions, it was a focal fatty echogenic lesions in the liver. So this is on the usual gray scale without any contrast. It was echogenic. After giving, this is also an arterial and portal or late venous, it showed there is enhancement was isoechoic to the liver. The same in all of the 3 phases. And so this focal fatty is benign entity, and it shows enhancement similar to that of the liver. The case number 4, a 12-year-old boy, he has a history of cirrhosis. And we know any child with, or any patient with cirrhosis, we're always afraid of risk of having hepatocellular carcinoma. And the most common burden is when we have a new enhancing nodule. So it was undefined through an annual surveillance of MRI. So an axial, non-contrast, enhanced fat, T1 weighted image. There was this nodule, and within giving contrast, it showed that it was a high intense signal. After giving the contrast through the arterial and then venous portal and then late venous, it showed that the lesion have taken also the similar enhancement pattern to the liver. It was isoechoic. So it represent or it consistent with regenerative nodules, and by showing this,
it was a big problem solver.
Yes. The enhancement pattern, as we said, is consistent with this benign regenerative nodule. It was not easily seen on gray ultrasound. It was not visible on T2 weighted image. And this was a problem solving, and biopsy was avoided. And these nodules can easily be followed by contrast enhanced ultrasound rather than other cross-sectional images. Case number 5, a 6-month-old girl. It was initially underwent MRI image for assessment she had a precocious puberty. And as they do these abdominal screen or general screen, they send on by T2 weighted image. They show incidentally there is an hyper intense focal lesions, which was not completely assessed. and it was tailored that it is only for the evaluation of precoce puberty. This was the lesion on T2 weighted image, and when we did ultrasound, it was heterogeneous, but predominantly it was echogenic, and it was ill-defined. After giving the contrast for this child, عفوا, he described it as it's hyper to with hyper heterogeneously, but is more hyperechoic. Anyway, so this lesion took an early enhancement during arterial phase. With the delayed phases, it was early washout. And the child, they did also blood, and it showed high elevated alpha-fetoprotein. Later on, they did biopsy for this child, and it was approved that it was hepatoblastoma. So the sequence MRI was not indicated, and was no additional image will be required. Performing, as we said, also enabled the patient to avoid additional sedation and gadolinium exposure for this child. So they just preserve for the ultrasound biopsy, and that's it, and follow up later on, or further management. The last case is a child had a fall from a laser tag, and she had a liver lacerations. And on gray ultrasound, it was quite difficult because it showed there is echogenic area, and there was subcapsular hematoma according to this. However, on contrast, enhanced ultrasound, the liver has taken the enhancement or the contrast, and there was a serpentious defect like seen. And this type of laceration is consistent with a type 3 according to the American Association of Surgery, Trauma Association. Recognition of these, what else? Okay, conclusion. Yes, so as we said, it was very nice showing this type of lesions, and it enabled us to avoid also the child of doing him more CT or with contrast, of course, administrations. Especially this child was hemodynamically stable. As we said, if it was unstable, we have to do CT. So in conclusion, this technique can be, as we all know, ultrasound is a first line, and this technique can give now better characterization at safe, well-tailored, reproducible manner without ionizing radiation, sedation, or the exposure to the contrast agent that are associated with high risk. In addition to that, it provides a valuable real time, which is quite important for the lesion vascularity. Recognition of various enhancement patterns of the pediatric focal liver lesion described can aid in making definitive diagnosis and help for cases that require intervention rather than the conservative management. However, it has limitations. The poor visibility of the lesion, especially if the patient was of large body habit or obese. The lesion was too deep, and it is not have the capability to depict whether the width exactly of the lesions, especially in cases of malignancy. Still also in staging of the tumors or the malignancy, CT-MRI will give us a more comprehensive assessment for the disease, especially patients with non-primary. Thank you.
Thank you. It's very nice to know something about contrast enhanced ultrasound. You can see it is beneficial and can help to solve a lot of problems.